where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about Bell's palsy, the most common cause of sudden facial paralysis. It often appears overnight, leaving one side of the face drooping, the eye unable to close, and sometimes with changes in taste or mild discomfort. While it can be alarming, the good news is that with treatment, most people make a full recovery. To help us explore the causes, the treatments, and new regenerative options, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
It's my privilege.
So, what exactly is Bell's palsy?
Bell's palsy is a sudden, usually temporary, weakness or paralysis of the facial muscles on one side of the face. It happens when the facial nerve, the seventh cranial nerve, which controls blinking, smiling, and other expressions, becomes inflamed or squeezed inside a narrow, bony tunnel in the skull. Most cases are idiopathic, means we don't find out a clear cause, but some are viral reactivation, especially herpes simplex, which is the leading theory.
So how do we classify it into its types?
Well, doctors describe Bell's palsy in general ways, but most are specific to the etiology. So idiopathic Bell's palsy is a classic. In other words, we don't know the cause. Secondary facial palsy is when the facial paralysis comes from another condition, like a stroke, trauma, Lyme disease, or a tumor. Partial versus complete palsy, some patients only have mild weakness or only the top part of the face affected.
Is there a genetic component?
Genetics play a role for sure. Most causes are random, but about 4 to 14% are linked to family history. Some families even show multiple generations affected, suggesting an inherited predisposition.
What about development in the womb? Does that matter?
Wow, that's a good question. It sure can. The facial nerve travels through a very narrow tunnel in the skull. It's called the facial canal. If that canal develops unusually tight or small during embryonic growth, the nerve is more prone to being squeezed when it is inflamed. This helps explain why some families have repeated cases.
How does traditional Chinese medicine view Bell's palsy?
In traditional Chinese medicine, TCM, Bell's palsy is seen as an invasion of wind, which blocks the flow of energy to the blood in the face. Acupuncture points are often used to improve circulation, while herbal formulas can support recovery. Studies suggest acupuncture, especially when combined with standard therapy, help patients recover faster.
So, what are the main symptoms? How do you diagnose it in your office?
Symptoms usually appear quickly, in 1 to 2 days, and patients notice a droop. And the droop's nearly always only on one side. And there's difficulty smiling, closing their eye, or they have puffiness in their cheek. Dry eyes or irritation from not blinking, changes in taste, tearing or drooling are common, and diagnosis is nearly always clinical, meaning it's based on the sudden appearance of those symptoms that exclude other areas that support a Bell's palsy. Imaging or blood tests are only used in very unusual cases.
What is the standard of care in the United States?
The standard of care is corticosteroids like prednisone, often given as quickly as possible to reduce swelling, i.e. inflammation, and improve recovery chances. Antivirals may be added in severe cases because they address the herpetic simplex virus. Protecting the eye is critical, with lubricating drops being crucial. Ointments or taping the eyelid shut at night is also a good idea. You can also tape the cheek up so there's less drooping and it helps the muscles. Physical therapy with gentle exercises and often just rubbing that muscle in your face help you to retain the facial muscles. Surgery is rarely needed.
All right, let's talk about your office and the regenerative medicine that you do.
There's pretty exciting developments there because regenerative medicine, remember, repairs cells. And so you can inject, if you need to, the nerves by calming the inflammation and supporting regrowth. Case reports show remarkable recovery. We've had it in our own office. We also use exosomes that can reduce nerve inflammation and promote growth and get into the little nooks and crannies other things can't because they're so small. They're nanoparticles. Peptides, on the other hand, especially IGF-1, which is a growth factor, of course, supports nerve survival, blood flow, and absolutely enhances the success of the treatment. PRP, which is platelet-rich plasma, is a concentrate of your own growth factors and healing factors, has shown benefits, especially if the sooner you get it. It really helps nerves heal and increases circulation, so the muscles rejuvenate as well. They are being studied and represent a good future for the facial nerve recovery.
So beyond these medical treatments and these regenerative treatments, what can a patient do at home?
Oh, that's a good question. Eye protection with drops, ointment, and eye patches are crucial. Facial massages and gentle exercises to reduce stiffness are also a very good idea. And which side of the bed you sleep on, you don't want to sleep on that side. You want to get the circulation, so sleep on the other. Stress management and adequate sleep are essential and reduces stress. So if you do that, you can enhance recovery. Nutritional support with a balanced diet, hydration, and foods like vitamins, antioxidants, and intravenous therapies are very solid.
So what's the prognosis for these patients?
Oh, very good. Most patients, about 70 to 85%, recover fully within 3 to 6 months. There's a small percentage, usually under 15, 20%, may have lingering weakness or involuntary movements. We have seen very few that haven't recovered. It's just a question of degree. Severe paralysis at the start is usually a bad omen. Older age, diabetes, and delayed treatment are also in that group.
Well, let's hear your mnemonic for Bell's palsy.
Well, it won't surprise you. We use the word FACE.
F stands for?
Facial exercises to keep the muscles active.
A.
Act quickly. Start steroids within 72 hours.
C.
Care for the eye, drops, ointments, and protection.
E.
Encourage rest and stress reduction.
Well, I want to thank you, Dr. Henderson, for helping us understand Bell's palsy, a sudden and distressing condition that with early care usually resolves. If you or someone you know experiences sudden facial weakness, seek help right away. Early treatment makes all the difference. Well, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.